Dignity is the inherent value that every person possesses, simply by being human. It is a sense of self-worth that we all carry. In medicine, we often place patients in situations that test the limits of this feeling. Few positions are as challenging to a person's dignity as the lithotomy position. In plain terms, this is when a patient lies on their back, often at the end of an examination table, with their legs separated, raised, and supported in stirrups. It is a position of profound physical and psychological exposure, designed for medical access but inherently invasive to a person's private space. The very nature of this posture can make a person feel less like a person and more like an object of clinical focus, creating a deep sense of vulnerability and shame. The first and most critical step in protecting dignity is clear communication. Before a patient is even asked to assume the position, the nurse or clinician must explain what is going to happen, why it is necessary, what the patient can expect to feel. Use simple, plain language. Avoid jargon that can confuse or intimidate. For example, instead of saying, "We need to get you in lithotomy for the colposcopy," one might say, "For this exam, we need you to lie on your back. Place your feet in these supports." This helps us see clearly to get the best information for your health. "I will be with you the entire time." This simple act of explaining transforms the patient from a passive recipient into an active partner in their own care. Informed consent is the formal outcome of this communication. Consent is not a signature. It is an ongoing process. The nurse must ensure the patient truly understands and agrees.
Do you have any questions for me?
Wait for the answer. If a patient hesitates or expresses fear or seems uncertain, everything should pause. Once communication is established, the next focus must be on the physical environment. Protecting a patient's privacy is a powerful, nonverbal way of showing respect. The first action is simple: close the door. Pull the privacy curtain completely. These are not trivial details. They are physical barriers against exposure and embarrassment. The room should be a sanctuary, a private space for the patient and the necessary members of the care team only. Minimizing foot traffic, preventing unnecessary interruptions, sends a clear message that privacy is a priority. The moment is protected and exclusively focused on their well-being. The art of draping is central to dignity in the lithotomy position. Cover as much of the patient's body as possible for as long as possible. Expose only the small area necessary. A warm blanket provides physical warmth and psychological comfort. Arrange the leg and perineal drape meticulously, never throw it carelessly. Unfold and place it with intention, creating a visual shield for modesty. Keep time and position to an absolute minimum. This requires preparation and teamwork supplies and equipment within reach. Roles confirmed. Ask the patient to place legs in stirrups at the last possible moment. When finished, help lower legs and cover immediately. Every second saved reduces vulnerability. Section 4. The human touch, comfort, and culture. Beyond the mechanics of privacy and timing, the human elements of care are what truly protect a person's dignity. Staff should make eye contact with the patient and address them by their preferred name. The conversation should not cease once the procedure begins. Maintain a calm, professional, humanizing dialogue. Avoid casual, unrelated conversations near the patient. This is depersonalizing. A gentle touch, if welcomed, can be a powerful gesture of support. Managing pain and physical discomfort is critical. Before the procedure, explain what sensations to expect: pressure, cold, cramping, and discuss pain relief options. How are you doing? Please let me know if you feel any sharp pain. If the patient says the pain is too much, pause the procedure. Respect for cultural and personal diversity is non-negotiable. Patients hold varied beliefs about modesty, gender, and the body. The best way to show respect is to ask, "Any cultural or religious preferences? Would you prefer a female nurse or doctor?" Simple accommodations, allow a head covering or a same-gender family member, can make a profound difference. After the procedure, care is not over. The debrief is crucial. Explain findings in simple terms. Ask how they are feeling. Offer a moment to rest and privacy to get dressed. Section 5. The system of care. Checklists and conclusion. Good intentions are not enough. The solution is a smarter system, a simple dignity-first checklist. 1. Explain and consent. 2. Ensure privacy. Door closed, curtain pulled. 3. Drape respectfully. Warm blanket, minimal exposure. 4. Offer chaperone. By name and role, confirm preference. 5. Minimize time. Be prepared.